The following is a presentation of Project Independence and WCWP. Project Independence is the Aging in Place initiative of the town of North Hempstead.
Welcome to Project Independence and You.
And welcome to Project Independence and You Community Talk Radio here on 88.1 FM and WCWP. I'm Kristina Liu. I'm hosting the show today, and we have Otto Lohse with us, our co-host. Otto, I feel like it's been so long.
It feels like it,
right?
Yeah.
I feel like I was like, oh my God, when was the last time we had Otto with us? But I'm glad
weeks.
you're here. And we're going to be talking about our favorite topic, which is mental health, which we always kind of find that we discuss on this show. And our guest today is Rachel Priest, who is the behavioral health educator over at Mental Health Association of Nassau County. Rachel was just at our advisory committee too, giving a wonderful presentation and some great information for all of our residents. So thank you, Rachel, for being with us.
Thank you so much for having me today.
Yes, and we thought it was very fitting. We wanted to have you today because in May, as we all know, is Mental Health Month. So we just thought it was suiting to, call you in and hear about the wonderful stuff that is going on with the Mental Health Association.
Thank you.
So let's start a little bit. We're talking about the Mental Health Association of Nassau County. Can you just give us a little brief overview of it and just some services that are involved?
Sure. So the Mental Health Association of Nassau County is over 70 years old. We have been in Hempstead since at least 2006, if not a little bit earlier, but we've always been a part of the Nassau County community. We have over 30 programs that we offer for community members. We have some main departments that these programs fall under. We have programs for individuals with serious mental illness who are ages 18 and up. We have mental health housing that goes through a centralized location that has different levels of housing depending on where somebody falls on the mental health spectrum. We offer services like care coordination that are kind of a wraparound service that help individuals who need assistance in getting to their different services that they have and kind of just making it easier for them to understand the services that are there. We also have a financial management program that assists individuals with getting them on the right track to how to learn how to manage their money. It might have been the first time that it's been something they've had to do if they're getting Social Security or disability. So these are all to assist them to get to their own wellness. That's really what our programs are for, to assist people for wellness. We also have veterans programs and education and training department where I work, where we provide low and free trainings for both the community and individuals who are mental health professionals to work on getting more credits for their licenses, as well as learning new things within the mental health field. We have a lot of new and up and coming trainings on services in the community that are new, that people haven't even heard of before. So in total, we have a little over 30 programs, depending on really how the departments are looking. But we never turn anybody away. One of our biggest programs that we are proud of is we have a support group for parents of adult children with mental health issues. Wow. So that's a wonderful service that is very hard to find. So we're very proud of these programs because they're very unique. It's hard to find these types of services, and we really encompass all of Nassau County.
Rachel, a question on like an overview of the organization. It's described as a not-for-profit membership program. Who are the members? Who would members be of the program, of the association?
So members of the association are individuals who believe in our programs, who want to see our organization do better. And these members are individuals who want to donate to the organization and want to, be kept abreast of what's going on within the programs. So we have the opportunity every June for individuals to come to an open meeting to learn about the the services that we're doing, and those will be our members.
Okay. And the other part of it is that I didn't get clear until I did a little research, is that the organization is not a government agency. It's a local, or maybe describe what that actually means.
Sure. So when we talk about being a non-government organization, you often hear about the Office of Mental Health, the Department of Health. Those would be the government arms of the mental health services within the Nassau County. Our programs are supported by grants, donations, and also insurance. So, for instance, our day program for the individuals with serious mental illness, most of these individuals have Medicaid, and that's how these services are paid for, through billing.
Okay. And it's a national organization. So
So
would there be multiple locations within
absolutely.
New York, let's say New York State?
So the way it works is we are, of course, the Nassau County version of Mental Health Association. In Suffolk County, we have the Association for Mental Health and Wellness, who would be the Suffolk County arm. And then under that, we fall under the umbrella of something called the Mental Health Association in New York State. So within many counties in New York, not all of them, because some counties are very small in upstate New York. So you have kind of two counties put together. They have their own mental health association. We're one of the larger ones. Some of the upstate ones are a little bit smaller. For instance, you have one. The one that's coming to mind is Mental Health Association in Southern Tier, which is all the way up in Nassau, but they do have, in New York State, but we all fall under the umbrella of mental health associations in New York State. And then if you were to go even further out from that, there is Mental Health America, which is the national organization that we all fall under.
Okay. So it's not like just a local shop. It's
No.
a major organization, really.
Yes.
Right.
Yeah. And now, Rachel, I just want what is, and we'll give this out throughout the show, but what's the main contact number someone would call to get in touch with the Mental Health Association?
So you can get in touch with us. You can call our main number at 516-489-2322, and that'll get you to our main front desk, and you'll speak to one of our wonderful front desk associates who can really direct your call to whatever department, director, person you need. If you're not really sure what you need and you describe the services to them, they pretty much know everything.
Great, because
So
that was going to
they'll
be my
be
next question.
yeah, they you can describe what you're looking for, even if you don't know you're looking for, say, our pros department, but you say day program, they know that that is the pros department, which stands for personalized recovery oriented services. So they can immediately switch you over to an intake specialist for that. If you think you need housing, but you don't know, they'll switch you over to the director of housing who can explain all of that information to you. So they're really good at going through what you think you need and you don't know, and they can help you with that.
Now, like on a local level, like where we are, and with Project Independence involved, could somebody also come in through to the program via something like Project Independence?
So it depends on the type of service that you're looking for. With mental health housing, for instance, there's a centralized intake process that is required to go through, and there's some very strict guidelines for that about individuals who have certain types of criteria they must meet. So that is one example. With our pros program, which is that serious mental illness program, that is all self-referral. So if it's somebody who is interested in that program, thinks they need those services, isn't sure, they can call up themselves. With all of that said, because I know that Project Independence has an arm of social workers and other professionals that can help connect to others to those services, we are always more than happy to talk to them and see what services may be beneficial for individuals who are part of Project Independence and looking to, receive additional services.
Often as I visualize it, and I'm not experienced necessarily, but the person who needs the help is not really going to be the one, in my opinion, who's going to call.
Seek it out,
Uh,
right?
I think it'd be friends or family for the most part. And this housing thing that you're talking about is one of the things you read about occasionally nowadays. Basically, in the past, whatever housing we had for people with mental health was shut down. So I've heard the phrase therapeutic housing. Is that kind of what the umbrella is for what you're talking about?
So what our agency has is several different levels, depending on the needs of the individual and also the availability. We are not the only agency on Long Island that has this type of housing. I want to, let you know that when you do go to the centralized location, it really is also the availability of which organization has an opening. So it is not just us, but there are several different levels. The first level is a community residence where it's several individuals living together with 24/7 supports, right? So there is always somebody in the house to help them with medications, if there are medications, getting to therapy, excuse me, always there to be a support to them. We also have different levels where it is different apartment style housing, where they have 3 or 4 people in a shared space who do get a visit once or twice a week from a counselor. And then it goes up to there from apartment housing where an individual will live alone and get a once or twice a month visit. But it's really, that is our most independent level housing. So it depends on the needs of the person.
With the association, like I could visualize, and I happen to know a situation where somebody should be in housing and they're going to be forced to be in some kind of housing because the house he lives in right now is being sold. So he's not going to be there anymore. But this individual has some mental health problems and isn't going to jump up and down and say, oh, I want to go to some new housing. Would the association provide guidance or support in how to help get that person to either want to or get into that kind of housing?
So one of the very delicate things that we recognize is that we cannot force anybody over the age of 18 to have services if they don't want them. It's very tricky. It's very delicate. And it can be uncomfortable. We can have as many conversations as we want. We can go to a support group ourselves to learn different ways to have that conversation. But it's hard because we can't force treatment upon anybody. Which is why we do offer those support groups for individuals with those adult children. But what can be done is you can always call our department. You can always call up to find out exactly what goes into the housing system to get the information that may make the person more comfortable. It's not immediate placement. We have to say that you don't just apply and get housing. There is, a process. So we're always willing to explain that process and help that person.
And I think
And
Otto,
the family actually, I think, who's
And
involved.
yes.
And I think that that's what's so important, because I said, listen, and this is with so many issues, we deal with this at Project Independence as well. It's the person that needs help, it's usually the family member who's saying, oh my God, my neighbor, oh my God, my sister, she's in this situation. But, that's where like a Project Independent social worker can help facilitate the process, and talk to the senior about this services that the Mental Health Association has, so then this way it's more of a, integral kind of process. Because listen, it can be overwhelming. No one immediately wants to jump to those situations, but I think it's so important to just be aware too that these services are out there, and I mean, it's just the Mental Health Association, we have been, partnered with them and worked with them for so many years. And I'm always learning something new about what you guys do. And I think it's so important. I mean, this housing topic comes up, all over the place for numerous reasons. And I think especially in this mental health realm, it's really difficult to, have your own place. And I love the different levels of support, so it's you can kind of see where you might fit best, which is lovely.
Well, I think the term that you used hits it right on the nose. It's delicate at
Yeah.
best. All right.
Yeah.
There's no, you can't just take somebody out and drag them into the new house and say, here you are, this is your home. I don't think it works like that, which is difficult for everybody involved, really. There's no shortcuts, I'm afraid.
Certainly no. And that's why, these wonderful, agencies like Mental Health Association, to have these trained professionals who are aware of the delicateness of the situation, because that's so important in dealing with someone who is struggling with, mental health issues or whatever it might be, so to have, these wonderful counselors that, understand, it's a process, and you have to be just as kind and aware of those things to people than anything. So
It strikes me that the earlier you try to help somebody with a mental health problem, the better, because I've witnessed a few of them, and if not taken care of, they only go downhill and get worse. So I think one of the words that I would encourage is, if you think somebody needs mental health, get it, help, as early as you can, and forget the stigma part of it.
Well, speaking of that, I know we've mentioned it on the show a bunch of times too, is that, in schools now, they're really incorporating more awareness on mental health. I know a lot of my friends' children's, like do little mindfulness moments, so I think we have a good trend going. So, but we are at the end of our first segment. We're going to take a quick break. This is Project Independence in You on Community Talk Radio here on 88.1 FM and WCWP. We'll be back with Rachel Priest.
Take WCWP with you wherever you go with the WCWP app. Listen live 24/7 to all of our streams, all from one app. Plus, call the studios directly from the app and visit our social media. Download the app through the iOS App Store on Apple devices or the Google Play Store on Android by searching WCWP Radio, or visit WCWP.org for links. The WCWP app, available now on iOS and Android devices.
And welcome back to Project Independence in You here on Community Talk Radio on 88.1 FM and WCWP.org. We are speaking with Rachel Priest, who is the behavioral health educator over at Mental Health Association of Nassau County, in honor, of course, of May is Mental Health Awareness Month. So we just are talking about all the wonderful services that the Mental Health Association has to offer. And I know you had mentioned, we did some housing. And that's just one of the realms that the Mental Health Association gets involved in. And what other kind of support groups are offered?
So our biggest kind of support group, beyond the one for adults, but for parents with adult children, is our peer support groups. So we have, and I can't believe I forgot to mention it, and I'm kind of like, hitting myself on the hand for that, is one of our biggest departments is our peer department, where everybody in that department is somebody with lived experience with either mental health, substance use, or both. Every single person in this department is a peer specialist who has been through some part of the mental health system, has that lived experience of going through the motion of getting help, and giving others their lived experience on how they can go and through the system. We have two incredible respite houses that are completely run by peers. There are no clinicians in them. It's called Turquoise House 1 and 2. And these are respite houses that are intended to help individuals who feel they may be going towards a mental health crisis, but do not want to go to the hospital. We know the hospital is incredibly jarring, especially for mental health issues. But But these houses, when run by peers, they can help you get your wellness or recovery action plan together. It's known as a RAT plan for the different types of things in your life that you need help with. You can go there for up a certain amount of days. You have a schedule in place. You have a room to go to, and you can work on yourself. And
What
these services are completely free and run by peers who also run support groups that are completely peer run.
would it also include substance abuse situations?
Yes, it will.
Okay. Okay.
And now, is this with a turquoise house? Is that a temporary situation? Is there,
Yes.
like, so is there always a set amount of time, or it's kind of based upon the?
There is a set amount of time. The number of days is escaping me right now, but I don't think there's ever been any more than, a week of an individual. It is a case by case basis. The houses, what's wonderful about them is they are regular houses like we are all sitting in right now. They are not clinical locations. There is nothing clinical about them. There is, in the two houses, I believe 3 to 4 bedrooms in a very lovely neighborhood. And they have what would be a den where you can do activities, music activities, art activities, whatever you have, whatever have you, to work on your recovery. The hospital is a scary place. And also, if we're looking at it from another point of view, if we're not going to the hospital, we're not necessarily having to use our insurance, our dollar amount stays low. The peer respite houses are free. So we're really keeping our mental health costs down while focusing only on ourselves and having that support from others around us.
Well, let me ask you, this is another scenario I've heard, all right? Somebody winds up, a younger person winds up trying a drug of some kind, and nowadays some of them have fentanyl in them or whatever, and you only have to use this stuff once from what I understand, and it messes you up, and it could be serious, and they wind up going through a whole process about what medication and this, that, and whatever. Would that be something that this kind of turquoise house would be involved with?
So if somebody is using a substance and is exposed to fentanyl, we know that fentanyl is a very dangerous opioid, very strong drug. If they're receiving services, if they're receiving treatment as part of substance use, if it's part of their treatment plan, substance use, and they're starting to struggle and they think they may want to start using again, or if they're, really struggling to kind of get their footing, right? They may feel the need to receive services either at Turquoise House by asking for an intake to work with a peer to help them, get through that moment of crisis that they feel coming on, or they may just want to work with our peer services department who runs the houses by attending their support groups in that department. It's really up to them. We, especially at Turquoise House, they are willing to work with anybody who feels that they might be experiencing a crisis, and is truly and genuinely in the need of help and wants to work hard for that help. We don't turn away people.
That's good. I've unfortunately heard different things, and to know that there's a place, you look on the internet and see names and places, whatever, but to do research of that type of thing is very difficult when you're under stress.
Of course, it's overwhelming, and you're so right. I don't and that's what the beauty of this kind of show is, because we can see it. Okay, we see it on a piece of paper. Turquoise House, sounds lovely, but to really hear about it and hear what it is, and I think the component of having these peers who have been through, these situations, especially when you were struggling with your mental health and feel so isolated and alone and it's only happening to you. I mean, I think we all, have dealt with these kind of feelings, and to have someone, who was doing, it's essentially like a sponsor kind of situation. And I think it's just such an incredible service.
And I think what I want to mention also about our peer services department is peer work has been the backbone of the mental health and substance use movement for years. Our peer department is over 20 years old and has always been one of the biggest departments that we have. Our peers are the unsung hero of our agency.
Absolutely.
And, definitely need to be recognized for the hard work that they do.
And Rachel, so become a peer, like, is that something that, they would call the Mental Health Association also and say, like, I'm interested in being but you need some kind of, degree or trade? Like, how does that work?
So it's actually wonderful that you asked that question, because I love talking about this. For the longest time, peers were just volunteers with the mental health, movement, taken for granted for all of the amounts of education of experience that they had. But wouldn't you know it, in the last, I want to say, about 5 years, people got wise to just how important peers are. And starting in New York State, you are now able to get a certification as a peer specialist.
Oh, wow.
There are modules from something called the Academy of Peer Services that you take online that are free, that you get a certification as a peer specialist. You get, much like a social worker would have an LCSW or an LMSW, letters after their name, peer specialists would also have letters after their name. They're required to do a certain amount of volunteer hours working as a peer to go from provisional to a full peer specialist. And we love our volunteers at MHA. We have a full volunteer and internship program. And anytime somebody's interested in becoming a peer specialist, we have them connect to our peer department to find out, can they volunteer, or can they be hired and work towards that certification while working as a peer. So we really like having peer specialists call us and ask us how they can contribute.
So they can volunteer and / also have a job, basically, being peer specialist.
Yes,
Is
our
that right?
peers.
Yeah.
Yes, our peer department is, I believe, one of the largest departments at our agency, because Turquoise House runs 24/7, 365 days a year. We need, we need people. And we need people who understand it.
And that's what you took the words right out of my mouth, Rachel, because that is the key component. It's people that understand, because, that in itself is just going to, make it a more successful situation, and I can't stress the importance of, support and to really have that. I think about that with everything, every program that we have, having this support group kind of component is just so beneficial.
Not knocking people, but it's easy for some people to say, oh yeah, just, you could do this,
Right.
Do that or whatever. And you have zero experience and you really don't know what you're talking about. You mean well, but
it's hard.
Better.
It's one of those kind of situations. Like, listen, I've dealt with, addiction and in my family, and it's a very hard thing to navigate for someone that's not necessarily,
I've been there too.
You don't know, right? I mean, you just don't know what to say. You can get angry, or there's such a dynamic thing. And that's why, when you had mentioned that first group about having a support group for, the parents of, the child that's struggling with, because it can just be so complicated when you don't understand what's going on, and, and it doesn't serve anyone, it has impacts for everyone to not be aware of kind of how to deal with these, once again, very delicate situations.
And the other thing I want to mention, lastly about Turquoise House especially, is we don't hone in on a certain age, because we know mental health and substance use can strike at any age. So we have peer specialists who run the gamut of the age ranges.
Oh, that's what I was
Because
gonna ask you. So can you be any, or is it like an 18 and older situation, or
basically,
yeah?
yep, basically. We do the same thing with everybody that we hire at our agency. A background check, some fingerprinting, right? Making sure that all your ducks are in a row. But if you're 18 and up and interested in being part of our organization, whether it is through volunteering or any open position we have, we want you because we want your experience, we want your expertise, and we recognize that that doesn't necessarily come with a certain age. That comes with your lived experience.
Yeah.
Now, you say 18, but I read also that you have a school program, which would obviously hit people under 18. What is that all about?
So are you referring to the school mental health? Which school program are you
I'm
referring
not sure,
to?
to be quite honest about it. I just see that you have programs related to schools. Um, and I was curious because, you read a lot about the kids nowadays having mental health problems because of COVID and everything else that went on. Uh, is is that an area that the association gets involved with?
So when we don't work directly with schools in the form of counseling or any of that, what we do is we, when asked, of course, come in and do workshops with both really middle school and adult and high school faculty. Really is where our focus is on, about the mental health and substance use, really what's going on with the youth today.
Yeah,
So
because
we
that actually I was thinking that too, because many years ago, and I don't even know if I was still an intern for Project Independence or if I was hired at that point, but we all actually did a training with you, Rachel, and where she trained, it was a bunch of us, professionals on these things, so because I think that that's, so important, especially in a school setting, to know how to, appropriately, communicate and recognize different things in the students.
the other thing that we did is we have worked with BOCES especially to bring workshops on a larger scale to Nassau County educators, to then bring back to the districts. We found that working from that top-down approach especially gives us the opportunity to reach more educators than just going to one specific district. But that being said, if a district calls and says, please come work with us, we'd love for you to speak with our students, we are more than happy to come in and work with students, do workshops at a student level on mental health and wellness. One of the things that's most important to us is not focusing on the negative.
Yeah.
We talk about wellness, we talk about health, we talk about whole body wellness, to make sure that students are recognizing that mental health affects all parts of the body. And that's what we focus on with them. And we, make sure that it's age appropriate.
That's a good point. Basically, wellness is you're trying to prevent a mental health problem by giving you the tools to
And
try not
it
to
is
let
too.
that
It's like,
happen.
and with wellness, I think it kind of takes away, that stigma of things, because you're just thinking, all right, like wellness, like I mean, who doesn't want to, it's an appealing term, and that's something, Rachel, we always say on the show after this, we have our talk of the town, and mental health really comes up, and this was especially during COVID. Because we were here, we were literally going through it in real time. And I always say this radio show kind of became like my little support group, because I was voicing my fears, and we were all kind of going through it together, and we always, really talk about, I'm constantly buying everyone, mindfulness, mental health kind of gifts and stuff. And I think it is so important. And you gave out during when you were at you did the presentation for the advisory, and it was that 8 dimensions of wellness. And I think it was so useful. I printed out and I kept it on my desk because, as you mentioned, it is up, and Otto has it right in front of him. You see that? He has, it's like show and tell.
Yeah.
But it's just so important, because it lists, environmental, emotional, financial, social, spiritual, occupational, physical, intellectual. I mean, that is all encompassing of, the human body, human self and surroundings.
Well, if you think about it, we had somebody on a couple of weeks ago about dental oral health.
Mhm.
All right. And the segments are prevention. Uh, and then if you do have a problem, diagnosing it and how you're going to fix it. And, basically, this is the same thing, except we're not talking about your teeth. We're talking about your mind. And how do you keep your mind from getting into trouble, if you will, and make yourself happier? And it's work. It's not, we talk about this often. Most people do not jump up and down when they wake up and say, oh, this is another a real great one. I think a lot of us want to be like that,
Yeah.
but you kind of have struggles of little things that go on in your life, like cable mix-ups or whatever, when your day starts. So how do you handle stuff like that so they don't become too big?
And I think, Rachel, and and wow, look, we're just like flying through this. So what happens? You get us going. We will be back with Rachel Priest diving into all things mental health and wellness. This is Project Independence and You here on Community Talk Radio, 88.1 FM and WCWP.org. We'll be right back.
WCWP is your home for great music and great conversation. You'll find all that and more on WCWP.org. Listen live on the web, check out the lineup, subscribe to podcasts, and stay up to date on the latest station events. Get in touch with us and let us know if you like what you're hearing. And find out how you can support or get involved at the only community public radio station serving Nassau's North Shore. Plus, sign up to get a free bumper sticker. It's all online at WCWP.org.
And welcome back to Project Independence and You, Community Talk Radio here on 88.1 FM and WCWP.org. We've been speaking with Rachel Priest from the Mental Health Association of Nassau County for the past hour or so, really diving into important topics and some of our favorite topics about just mental health and wellness. And so many services you guys provide, but I'm always really impressed with the veterans programs that you have. So tell us a little bit about those.
Sure. So we have what's known, we're technically the house for the Veterans Health Alliance of Long Island. Sometimes you'll hear it referred to as Valley. We have a lot of acronyms. Mental health exists as a world of acronyms, so it just makes it a lot easier. But we are really the home base for the veteran services for multiple different agencies as part of Nassau County. We also host the Vet to Vet support group, which are services run by run by veterans for veterans, regardless of status as a veteran. We found that these support groups are run through the PFC Dwyer program, which is a grant program that allows these services to be free and open to all veterans. Support groups, especially for veterans, are crucial for their mental health. Additionally, we have so many other services that we work with other agencies with for the veterans department. We put on, and when I say we, I mean that department puts on tons of different events throughout the year, outings and fundraisers, and really also allows veterans to access services that they weren't sure that they could access. They really exist to help veterans network throughout the different, it's hard to network through mental health services in general. So when you add the veteran component to it, it can be a little even more difficult. So the Veterans Department really exists to centralize the availability of reaching out for services.
Do you get younger veterans engaged?
So while I'm not to be honest with you, I'm not exactly sure of what the scope of the age is for the veterans. We do make sure our services are accessible for all veterans, regardless of their age and their discharge status. We have very specific events for them as well to be able to meet up with veterans from their own units and ages.
Yeah, I know various organizations like American Legion, Veterans Foreign Wars,
Hmm.
the Veterans Advisory
Hmm.
Council from town of North Hempstead, all of whom I talk to people, and they all have a problem
Yeah.
getting the younger guys and girls who are veterans to come out. And
Yeah.
I think it's
No,
important.
that is a real problem, and that's something,
Yeah,
and over at Project Independence, we have our veterans caseworker who, can facilitate. And obviously, if you want to get more information about what the Mental Health Association has to offer, she could, talk to you about that as well. But I think that that is a huge problem. Listen, I have a lot of friends that are veterans, on the younger side, and they're not, you know, involved in the VFWs and the American Legions. It's just a different shift. It's like even like with different senior groups, there's not, it's a hard thing. It was a not necessarily a thing of the past, but it was very popular then, and a lot of the new ones aren't coming back, and for various reasons. That's just not the thing, and that
well,
is
I think a big thing is that back when those also served as social outlets.
yes,
There was
absolutely,
more
exactly, right.
socializing, and that's not today's world. Today's world is people have their own social
Hmm.
life, if you will, uh, but they may have physical disabilities, mental health problems, guidance that they might need. Um, and I think that's where hopefully younger people can be reached.
And
Um,
I think that's why it's so important, really like a word of mouth situation and someone who is involved, so it's because then you're more likely to kind of get involved in it. I know, as I mentioned, my friend, he's he's in his 40s, and he, is a veteran. He's retiring from the police force, and he doesn't even know what kind of services are necessarily available for him because he is a veteran, and that's something that I think, it's so important to, reach out to these organizations because and get connected, because there's so much that you probably aren't even aware of that, is covered for you, or you're able to get, based upon your veteran eligibility or whatnot. And I just it is something, and I'm so fortunate to have, the platform that we're able to kind of promote these services and get the word out there, because it's certainly important for, veterans of all ages to get involved in these things.
So I think one of the things that's important about that is that both of you said is younger veterans are finding it harder to connect and socialize as a younger veteran. And this just popped into my head. Our veterans department actually organizes retreats away,
Mhm.
overnight retreats, sometimes 2 days or more. And you're going to a lovely hotel like location, and not only is there talk about veteran services, but there's the opportunity for yoga and relaxation and mindfulness and meditation workshops. And that way you're working on your mental health,
Yeah,
but it's also a retreat with other veterans,
yeah.
so you're in a community of your peers all working towards a healthy goal.
That's
There's the word
incredible.
peers again, which is,
Yeah.
Yeah, you'll see I go back to the word peers
No,
quite
because
frequently.
it's something that in no matter what realm of things, we see it all the time, like the benefits of, even with our own program. I mean, so many people, we've been around for a long time, but join because, oh, my neighbor told me about it. Oh,
Exactly.
and we always say to our, obviously Otto's, the face of Project Independence on our brochure. But but we call them like our PI ambassadors, the people that you met,
a
Rachel,
lot younger, by the way.
you look the same, my friend.
Yeah.
But at the advisory committee, those they come every month, and we call them our ambassadors because they are the ones that are going out there and kind of spreading the word. And that goes back to the old grassroots concept of, peers, and how important that was. And the sense of community. I mean, it's so beneficial for so many things, to have this kind of peer support. And I just think it's wonderful. I mean, it's just the Mental Health Association, I can't say it again, they just have so many services, and we're only scratching, I love that Rachel, like, oh, it just popped in my head, like we do this like amazing thing, but it's so great because you guys, there's so many different programs and pieces to it. And I think that, the more mental health and wellness is kind of out, I definitely have seen a shift and seen, more on social media or on television, and especially coming out of COVID, I think people really started to realize, the effects of mental health. And I really hope that this shift kind of continues to happen,
Do
and
doctors provide referrals to the Mental Health Association?
We
Um,
hope so.
yeah,
Um, we are fully in belief that for mental health, everybody needs to be involved. One of the best ways, if you need assistance with your mental health and you're kind of, I don't know where to go, right? If you have an appointment with your primary care physician, your general practitioner, whoever that is, ask the question of them. Do you know any mental health services? We work with primary care practitioners. We have been around for so long. They know who we are. They know where we are. When you call referral lines, you will get our phone number, our main line, that 516-489-2322.
I'm sorry, 489-23.
2322.
Right.
So you will be able to connect with us. We make it, a point of having connections within the community. We know how important it is to collaborate, not just in mental health, but health in general. Collaboration is key. Nobody is an island, especially with their health. And we need to know what the other hand is doing, right? If a mental health practitioner prescribes one thing and you have a physical practitioner with another, we want you guys talking. We want you having conversations. We want your care coordinated. Right? It's Mental Health Month. And for us, it's important that your outsides and your insides are talking to one another, right? That what's going on outwardly that impacts you physically and mentally is all on the same page. And there's certain ways to do that. And that first step is talking to that primary care physician and having those referrals.
I could see where it could get pretty complicated between possible dementia and cognitive kinds of decline or mental health. It's like,
yeah, well,
what
it all like
what are we
overlaps.
dealing with here?
Yeah,
And the
and
doctor
that's
is the
why.
one who could help establish that.
No, and I think, you hit the nail on the head there. It's just, to have that collaboration, I mean, listen, this is why we have integrative health and all these things, because you really want to, get that full picture, because everything affects everything. I mean, listen, when I'm stressed out, I can feel the effects on my entire body, and like, I think we all could understand that, and obviously the degrees in severity, can vary. So I think it is so important to have that kind of collaborative care. And I do see it, a shift in the way that we look at it, as I mentioned earlier, which hopefully, will continue. And I love the theme about that we have this month for May is Mental Health Month. And Rachel, we love this show. We always call them our golden nuggets, our tips. We keep to learn after each show. So is there just like some little tips for people that want to better their mental health or wellness?
So this year's theme again for Mental Health Month is taking a look at what's around you. So not everybody wants to exercise, right? Not everybody wants to get out and take a run. Not everybody wants to clean their house from top to bottom. Not everybody wants to do these things because it's exhausting and it takes a lot out of us. But with all of that said, taking a look at what's around you and starting small can really lead towards improving our mental health. Taking a walk, 5 minutes outside, enjoying what's around you. If you have a messy place in your one of your rooms at your home, starting to work slowly, really be able to tackle a pile of clothes that maybe you have, do some dishes that you've been putting off, making it so that things that are around you are more pleasant and more comfortable can really impact your mental health for the better.
Yeah, and I mean, listen, that is pretty much that falls out of my mouth, every week, because I'm open about my own little anxieties and whatnot, and doing those little things. And I like that, it can be the smallest little thing, and you really do feel good after it, and obviously, if you are struggling with your mental health for various reasons, it's even harder to tackle these tasks, right? Because if you're feeling depressed or anxious, like everything just seems so overwhelming. But I do believe that, when you accomplish something so, a small little thing, it really goes a long way, and to take that walk. I mean, Otto and I are both like love a good stroll around the neighborhood, and to just be aware of your surroundings and to take that in, I think is
Well, the
just such a
mindfulness
important.
concept, be aware.
You had mentioned Rachel, and she gave out a lot of great information at our advisory committee. And anyone that was not able to attend that and is interested in the information, I have copies of everything. So you could certainly call 311 or 516-869-6311, and I'd be happy to send you the packet. Because what Rachel did give us too, which was fabulous, it was a calendar. It was a May 2023 calendar that has a little kind of tip. Yes, she's got the pretty color version. But what I love, obviously, it's, you don't have to only do it in May. All these things work wonderfully. I was during Christmas time, my mom had bought me an advent calendar that counted the days down to Christmas, but it was a mindfulness calendar. So each day when I had opened it, it was like a fun little thing to look forward to. And it was I love, this kind of situation that you can say, okay, I'm going to, do this today. And the little things add up. So I just I really encourage people. And
You just said something, by the way, do this today. That means you have to want to do this,
yeah,
because it doesn't happen by just going like that.
no,
You have to work at it. We're not selling anybody that this is like a wonder drug.
no,
You
it's
have to
certainly not.
work at wanting to have wellness in your mind.
Yeah.
It doesn't happen
No, and
by,
that's why, and I think when it does, I have a lot of my family, myself, we've all kind of had our different ups and downs with, mental health kind of things. And I have had, some family members that even struggle even more, that it is, as I said, so hard to tackle these tests. But that's, why it's so important to get help, to reach out to these organizations that are available. And we're very fortunate where we live that there's a whole host of places you can get connected and get the help that you need, to do this. Because listen, no one should have to live in a situation like that, where you can't, everything just seems so overwhelming, So I just think it's so important to spread awareness about this and just all the programs here. And I think, what I love about the Mental Health Association also, it's kind of the same mantra as Project Independence, in that, you don't necessarily need to know what you need. Like, just call and say, I just need help. I don't even I don't know where to begin. And that's what the person who's talking to you will kind of see where you fit and what your needs are. So I just want everyone to always know that, because I think so many people hesitate because they're just lost and not sure what exactly they need. They just know something's not right, or they just need some support, and then there is support out there. So I just always want people to, you just make that initial call, it's just, it can go a very long way and change your life. So that's my my PSA on all of that. And is there anything else, Rachel? I love the stuff that you gave us, and I want to tell people to check that out. The Mental Health America website really has such great resources. I was going through there when I was looking at some of the stuff that you gave us previously, and it's just a lot of great tips that go over all different things, within the society.
what was that website?
It is so it's for Mental Health America, but it's MHA and then national.org. And if you're watching this on video, I will have at the end of this, will be up, on the screen, the different resources and whatnot. But there's a great worksheets where I always say I love, kind of outdoor things. And that became really big for me. Like during COVID, I gained a whole new kind of appreciation for the outdoors and going for walks and looking at flowers and just taking it in. I think that, goes a long way. I'm not, as you mentioned, I'm not the one that wants to go for a jog or a crazy run, but I will go for a nice walk around the neighborhood. And it's just it's lovely. And on this website, there's a worksheet about opening your mind to the outdoors, and it's about meditation and just different things like that, which I think is just, we have the nicer weather now. It's a great time to get out there and to do that because it's beneficial for so many different things. So definitely
And those are
Yeah.
actually my favorite things, the worksheets and the calendars.
yes.
Having something to guide you is what's incredibly important.
And we are at the end of our segment, Rachel. We will be having you back on here. I can't thank you enough for joining us and bringing awareness to mental health and wellness here on Project Independence and You, Community Talk Radio, WCWP.org, 88.1 FM.